If Alaska were a country, it would be the nation with the world's highest per capita case rate. Basically, that means there's no room at the hospital.
She started feeling sick on Monday.
Hey, we have a COVID testing appointment at 3 o'clock.
So this is a self-administered test that you guys will do in your car.
So I've experienced COVID-related symptoms for 317 days. It's been the hardest year of my life, for sure, is not knowing and still not knowing and trying to figure out, is it COVID? I know that COVID had something to do with it, but is that just it?
I'm Morgana. I'm a humanitarian, photographer, and filmmaker. And this is my husband, Jaco. He's a helicopter pilot. In 2014, we were living in Liberia, West Africa, when the world's largest Ebola outbreak erupted. I helped PCI Media share Ebola survivor stories through radio, TV, and social media, reaching nearly 10 million people. It helped curb the spread of the virus by driving changes in attitudes and behaviors. I saw the impact the storytelling had on communities in the middle of the outbreak. So when COVID-19 started spreading where we lived in 2020, we began documenting and sharing stories of COVID-19 survivors in New York to spread awareness about the disease. But we decided that wasn't enough. We wanted to show how COVID-19 is impacting people across America. So we moved out of our New York apartment and we moved into a 19-foot trailer so we could document COVID-19 survivors in all 50 states in America.
Today, we start our journey to Alaska from Helena, Montana. We are driving to Tacoma, Washington to drop off the rig and our cat with Morgana's mom. Then, we'll fly to Anchorage, where we'll pick up a camper van to live in for the next week while we go and meet and interview COVID-19 survivors in Alaska.
We are on our way to see Kelcy, who has dealt with COVID-related symptoms for over 300 days. She thinks she might have something called POTS, postural orthostatic tachycardia syndrome, but she can't find someone who can test and diagnose her in Alaska.
Bye, bum. Yeah. You'd be good, yeah?
Kelcy's situation shows a big hole in the healthcare system in the United States. Because she's in a state with a smaller population that's more remote, they don't have access to as many doctors, especially specialists. There are not a lot of physicians who can diagnose POTS in the entire country, so there are very few places people like her can go to begin with. She can't even do a virtual visit with a doctor in another state because of licensing restrictions. Being in Alaska, she would have to fly, and that gets incredibly expensive. Health insurance companies probably won't cover that. It puts COVID long haulers in a really tough spot because they know something is wrong, they know they need help, but they can't get access to it without paying a very high price.
The federal mask mandate does require each person to wear a mask over the nose and mouth at all times throughout the flight, even while sleeping. This is required even if you have received a COVID-19 vaccine or a negative COVID-19 test. Refusing to wear a mask is a violation of federal law. And once again, I want to extend our apologies for our delay in boarding today, but we do surely appreciate your cooperation in stepping out of those aisles and stowing those bags as quickly and safely as possible. We'll help us get out as quickly as possible. Thank you so much for your attention and welcome on board. There we go.
Throughout the pandemic so far, cases in Alaska stayed fairly low, but as we left, the numbers began to go up.
On average, the U.S. saw a 26% decrease in cases over the last 2 weeks, while Alaska recorded an 84% increase. If Alaska were a country, it would be the nation with the world's highest per capita case rate. We are a state that has limited capacity. We have fewer hospitals. We have more limited means in terms of our ability to care for those who have become very, very sick, and it is straining. It is really maxing out our hospitals to levels that we really just could not have even anticipated could happen. Basically, that means there's no room at the hospital.
Many COVID long haulers can't work full time. Their bodies just don't have the strength to put in a normal 40-hour work week. After struggling with symptoms for months, Kelcy lost her job and then her health insurance, just when she needed it the most. We headed towards Sildanta to meet up with Kelcy, but on the way, my mom called with some troubling news.
I was at work, was gradually getting more and more achy. My body was just aching all over the place. And this guy took me to the testing site today. I was so thankful, and that went really well.
Okay. So you'll get the results within about a day or two?
Yeah. So we'll see tomorrow, probably, what the deal is. Meanwhile, I've been sleeping and sweating a lot.
Yeah, that's proper fever. Well, let's hope it's not COVID.
Yeah.
I would be surprised if it wasn't.
Hello.
Hey, how are you?
Hey, I'm alright. I literally just got diagnosed with POTS today, so.
What? Wait, how'd you get diagnosed?
My friend, that's a nurse practitioner.
That's amazing.
I know, so there's one thing.
Wow. I wanted to touch base with you about tomorrow and Friday. We dropped the rig off with my mom outside of Seattle and left our cat with her, and she started feeling sick on Monday. We left on Sunday, so everyone felt fine when we were there. No one was sick before that. We still feel fine. She just got a COVID test today. Our life will get very complicated if she tests positive. We haven't had any exposures this whole time. So we will see if we can go get tested as soon as possible tomorrow. And then we'll let you know as soon as we have the results from that.
Okay, perfect.
Okay, talk soon. Bye.
Okay.
Like, if your mom's positive, out of everybody and everywhere that we've been, all people.
I couldn't comment. It's one of the worst times.
Welcome to our life.
The next day, we got back on the road to Sildanta. But in order to do the interview with Kelcy, we needed a negative COVID test, so we started calling clinics in the area to try and find a lab that could give us a rapid test. Otherwise, we have to cancel the interview.
Your party is not answering. Please try your call later. We're sorry, but your call will now be terminated. We're unable to answer, but if you need anything, phone number and a brief message will get back to you as soon as we can. If this is an emergency, please hang up and dial 911. Transferring your call. Remember, you can always book an appointment 24/7 using our website. We're unable to answer, but if you need anything, phone number and a brief message will get back to you as soon as we can. If this is an emergency, please hang up and dial 911.
Hey, sorry, can I ask you a quick question? Do you know where the Whittier Clinic is? The Whittier Clinic? The Whittier Clinic.
The clinic. Awesome. Awesome.
Thanks, man.
Thank you.
Hey, I just wanted to check, can you do COVID testing?
We are only doing the send-out test. That's usually a 2 to 3 day turnaround. Unfortunately, we are not being able to do that rapid test at the moment.
Health clinic, where can I direct your call?
Hey, can you do a COVID rapid test?
Let me get your name and number, and let me get you with a scheduler and give you a call back if we're able to fit you in today.
If we test positive for COVID, it will be a logistical nightmare for us here in Alaska. We would have to find a hotel to quarantine in. It would be extra cost, flight changes. I wouldn't be able to go back to work. Yeah, it would be a nightmare.
Oh, shoot. Hi.
Hi, I'm calling from the health clinic regarding a call from, is it Morgana?
Yes.
How can I help you?
We were just wondering if we could get in for a COVID rapid test as soon as possible today.
Sure. Is it just 2 people or yourself?
2 people.
Okay, so if you come together, we have a 3 p.m. Does that work?
Yes.
The pharmacist can do a rapid test, and you should get the results back in about 15 minutes.
Amazing. Perfect.
Hey, we have a COVID testing appointment at 3 o'clock.
So this is a self-administered test that you guys will do in your car. Jaco, yours is the one in the bag, and then yours is that one. Okay, so you guys go ahead and open those up. Get the swabs out.
Am I gonna put it back in this?
Yeah, you'll put it back in the pack, yes. Okay, so it's a mid-nasal swab. You're gonna go ahead and put it into your nose, about 1 inch. Gently swirl, 15 seconds each nostril. I'll count for you, and then I'll tell you when to switch. Okay, go ahead, switch. Okay, you're done. Okay, now just slip it back inside of the paper packaging, and Jaco, you can go ahead and put it inside your bag. I'll grab those both from you. Okay, you guys are free to go. It takes about 15 minutes per test, and I'll call you about a half an hour and tell you what the results are.
Cool. Thank you so much. That's one of the easiest, ones we've done. Sorry, hold on. Putting you on speakerphone. There we go. Can you hear us?
Hey, yeah, yes, is this Morgana?
Yes.
Hey, I'm sorry guys, I got backed up and forgot to call you. Both your tests are negative. I apologize, that was so slow. I forgot to call you guys back, and when I saw your van outside, I thought, oh shoot, that was my fault, I'm sorry. But yeah, I'm sorry to keep you guys in suspense. They are negative.
Awesome. Thank you so much.
Thank you.
Shortly after our test came back negative, my mom's came back negative too. So now that all 3 of us tested negative for COVID-19, we could safely go meet up with Kelcy.
Hey,
How are you?
Could be better.
I'm sorry.
It's okay. We'll figure it out. I just can't get a baby today, so.
You're too small?
They were like collapsing, I think, because I'm like so dehydrated. Like my blood pressure is really low. It's like 90/72. So that's pretty low, even for me. Then I've been doing so good. So I'm like, what the heck? I don't even know what changed, but I don't know.
It'll be very real today.
Yeah, that's why I was like, I'm gonna look like pale and like actually sick, I feel like. So, and that's how I feel. So it is what it is.
We'll take our time, and if you feel like you need a break or you want to stop, then we'll stop.
Okay.
Hi.
This is my aunt.
Nice to meet you.
When I first heard about COVID, I didn't really know what to think, honestly. Being here in Alaska, it didn't seem like it was that big of a deal at first. I kind of felt like getting COVID was similar to getting the flu. I have no idea where I got it, honestly, no idea. I was diagnosed, or my test was positive anyways, November 3rd. Right before that was Halloween. Everything was open back up. A bunch of people were out and about. Even people that were positive with COVID, which to me was a huge deal. And it still honestly is. I remember I had a headache after that, but nothing crazy. The back of my shoulder felt like it was on fire. And then that Monday, I definitely had a hard time breathing. And that's when and then I had a cough too. And that's when I knew, I was like, I have COVID. I was really sick for the first 3 days. I almost went to the emergency room. I couldn't breathe, and it did slowly go away. It got a little bit better. My symptoms lasted for about a week and a half. My birthday is November 19th, so I was out of my 14-day quarantine. I was feeling better at that point, so I went to dinner. And I remember feeling like I couldn't stand up. I was so shaky and so weak that I had to sit the whole time. I've never felt that shaky and weak in my whole life. And that's kind of was the beginning of the end, I'll say, because that's kind of when everything started. 2 days after my birthday dinner, I woke up and I was like gray and yellow and it felt like something was really, really wrong. I had bronchitis and strep throat. I was severely dehydrated. I had to get 5+ bags of fluid. My eyes were sunken and I remember looking in the mirror just like thinking, this doesn't even look like you. I don't know if you're gonna make it. Like, am I septic? From then on, I just never got better. 2 weeks later, my weird symptoms started. My pulse went way up. I think it was 130 or 140 when I checked it. And then I started full-on tremors. It's the worst in this hand. It started here and then it went all the way up to my neck and my head and I was literally like convulsing. So there was one day where I was actually getting ready to go to work. It was like 7 in the morning and I got up and just felt really dizzy, and that's happened before. So I just kind of put my hand on the counter and in the bathroom and just was waiting it out because that's worked before. And it didn't work that time, and I ended up passing out, hitting my head on the counter. I had a big gash and a bruise, like right in the middle of my forehead, and ended up passing out in the bathroom. And I actually ended up in the emergency room after that. One of the things one of the nurses said was something like, well, we're not getting a lot out of this one, or something like that, just something like judgmental, and she just wasn't listening. She didn't even listen to me that I had fallen. That was never even in my chart record at all. What had happened was she told me I had a panic attack. She told me that my vitals were fine, my blood work was fine, everything was normal. They did a chest x-ray, that was normal. And she sent me home with a anti-anxiety drug, which is probably the worst thing you could do with a person that has a concussion, because you're not supposed to go home and sleep. I was like, this is not anxiety, this is not a panic attack, it's not up here, it's just like my body is doing it on its own. I've had 50 blood tests done. I've got bruises all over my hands and my arms all the time from getting IVs, and my blood work, it's all been pretty good. within the range. My chest x-rays have been normal. They have told me that my heart has been tachycardic, which beats a little bit quicker. It's been the hardest year of my life, for sure. I feel like I'm like holding on to things, like holding on to work, holding on to friendships, holding on to, energy and trying to keep going. Is not knowing and still not knowing and trying to figure out, is it COVID? I know that COVID had something to do with it, but is that just it?
When Kelcy couldn't find effective treatments for her symptoms in Alaska, she flew to Portland, Oregon to try a couple of unconventional therapies.
And then I think it was end of July is when I went to Oregon and I did the hyperbaric chamber, which I like to describe it as a personal submarine because you're 6 feet below sea level and they put you on an oxygen mask.
I survived day 3. Can't look around, but I don't know if you can hear the pressure. I'm going from negative 6 feet below sea level to back to sea level right now. There's still no oxygen in here, so put this guy's for. There we go. I just want to sing Under the Sea while I'm in here. Except that it feels like my ears are popping so bad now, but okay.
I noticed a difference with that, I think day 3 or 4, and it was huge. I don't know how else to describe it, but I felt lighter. I could think a little bit clearer. And then the other treatment I got done was the ozone treatment. It's like a blood transfusion, but with your own blood, because it's taking blood out and then putting it back in. When I got done with my treatment in Oregon, I felt like I could run a marathon. I felt like I could fly. I felt so good. I was thinking so clearly, feeling so light. It was so amazing. It was so amazing. And that lasted about 2 weeks. And now it's just all back. So all of those treatments that I got all together, I think was almost exactly $4,000.
That's a lot.
It's so much.
And I assume insurance doesn't cover that?
No, insurance doesn't. $4,000 for a treatment to only last 2 weeks is the most frustrating thing. Literally, I'm just living day by day, pretty much, and that's all I can do. So it's hard, but I've tried to adapt to it best I can. I really want answers. I really want medical answers, and the reason is I want to see what I'm working with so I can get the best future for myself. I have a very, very strong feeling I'm gonna have to deal with this for a really long time. This isn't just gonna go away, and I know that. I can feel it. But if I can at least get some kind of understanding, a diagnosis, something they think is going on, and change my life and start it now so I can get used to it and still be able to better my life. I want to get used to what my future is going to look like for me dealing with this illness so I can still give myself my best life even dealing with this.
Thank you so much for sharing your story.
Yeah, you're welcome. Thank you guys. Thank you for doing this and covering this and making the world realize what's going on and that it's not over for a lot of us. Not even close.
As we headed back to Anchorage, another survivor contacted us who was also struggling to find answers to symptoms that wouldn't go away.
I wasn't vaccinated, so that's probably why I had a severe case. Every single doctor that I came in contact with at my clinic, they don't know what's going on. They can't. Like, I have so many tests done. I have things done at the doctors, and they don't have no explanation for me. I'll be wearing this heart monitor until the 22nd so they can see what's happening. The more that it's known about, maybe something will change with everything. And that's why I reached out to you guys. I want to help.
After scheduling a time to meet with her, we found a primitive campsite at the base of a glacier to crash for the night before driving the rest of the way back to Anchorage to meet her the next day.
I think the glacier is behind us. It's over there. I guess we'll see what we wake up to in the morning.
If I probably would have got the vaccine, I wouldn't be where I'm at right now. I know that's how I contracted COVID, was definitely the birthday parties. He just started asking me like all these permanent questions, like I wasn't going to make it. I didn't know what was going to happen next. I was just really scared. Oh man, is it too late to get the vaccine now? When I was in the hospital, I found out that I was pregnant. It was really hard on my body, and I had to make a really hard decision.